panel session today, which is all about Islamophobia, raising awareness. So for some of you that may know, it's Islamophobia Awareness Month, and this is the first time that we're going to be having a conversation centered around Islamophobia, which I'm really excited about because I think it's really timely with some of the things that are happening right now with the World Cup, but also the fact that it's been happening and we've been talking about it for many years, and it's in the mainstream media a lot as well. So I think it'll be really good to have a focused conversation of what that looks like for pharmacy and how it can manifest. So I'm joined today by on our panel by two esteemed colleagues. So I've got Khalid Khan, who's the head of training and professional standards at Iman Healthcare, and Sharifat Kamal, who's a specialist pharmacist and also a BEMA council member. So thank you for both of you for joining us today. So just a bit of a background. So Islamophobia Awareness Month is a campaign that was founded in 2012 by a group of Muslim organizations to raise awareness of Islamophobia. It's widely recognized and aims to raise awareness of Islamophobia in society, as well as showcasing the positive contributions of Muslims in the UK. And the aim is to see a society free from Islamophobia in all of its forms. And this year, we're working in collaboration with the British Islamic Medical Association to host this panel to have a more focused conversation. So as I said, this is the first time we'll be discussing this topic in a reference to pharmacy, and it'll be good to understand what the prevalence of Islamophobia is in pharmacy and how we really want to raise awareness on this topic so you can recognise when it's happening and what it will look like in practice and how it can manifest, and to hear from experiences from members from our profession. And this year's theme for Islamophobia Month is tackling denial. So the denial of Islamophobia can take different forms and is found in both political and social spaces across society. And it's really important that we tackle denial of Islamophobia's existence, because by doing so, we dismiss lived experiences of many and also the opportunity to bridge the gaps between our societies and have a more integrated community. So I'll crack on with the questions now. So Khalid, I'll start with you. We'd love to hear more about you, and could you tell me about who you are, which area of the pharmacy that you work in, and what it means for you to be having this conversation today?
Thank you, and firstly, thank you for yourself and the RPS for hosting this event and really engaging with BEMA. For the listeners, excuse my voice. I've had a cold and I lost my voice. I just got it back yesterday morning, so it may come and go a little bit. My role is a community pharmacist. I work mainly in training education, so I'm responsible for kind of trainee pharmacists in our community pharmacy chain. We also work for Health Education England with kind of training for foundation trainees there as well. And up until recently, I was working for the GPAC part-time on the Fitness to Practice Committee as well, which gave me a bit of an insight into kind of the FTP process and what some of our registrants go through there. Why is it important to me? I mean, firstly, I'm a Muslim, but also, I've seen the rise of Islamophobia kind of exponentially over the last 20 years, I'd say, especially after 9/11, and that was understandably so. But I think especially recently with Brexit and other kind of world events and local events, you can tell it's not going to go away. It's just getting worse. It takes different forms. And I think for me, I'm quite lucky. I'm quite old in the tooth now. I can maybe handle myself a bit better. But when I look at our younger Muslim colleagues, our brothers and sisters, I do fear about the kind of the difficulties they're having to navigate through. How tough it is for them in the workplace, whether it's with their colleagues or whether it's with the patient populations that they're serving, and how resilient they can be, and how they can cope with that kind of attack, basically, and that sort of pressure. So for me, it's about how we as older members, more experienced members of the profession, can support them, but also on an organizational level, how our leading professional organizations, leadership organizations, whether it's the RPS, GPAC, etc., can all work together and collaborate with the likes of BEMA and with the professionals within the register to put that support and those structures in place to support all our registrants.
Brilliant. Thank you, Khalid. And Sharifa?
Thank you very much. I think I will just take it from where Khalid has said. As fortunate to have worked across so many structures in pharmacy practice, I've worked across all hospital, community, and I mean, at the moment, I work across COVID vaccination center. And what Islamophobia means to me is the fact that we, as pharmacists, come from different areas, different cultures, different barriers, different ethnicity, and the fact that we are not, if we're not tackling the denial, meaning that we're not being able to identify that some people are experiencing Islamophobia. Just like Khalid has just said, in workplaces, as pharmacists, with our patients, as pharmacy students, as pharmacist colleagues, we should be able to identify when Islamophobia is taking place. We should be able to listen to people that complain that they have been affected by Islamophobic acts. And we should be able to record instances, scenarios, acts of Islamophobia that is happening within pharmacy colleagues, within pharmacy students, within students to students, colleagues to colleagues, employers to the employees. Those are instances that we have to really, really focus on, and we should be able to accept it when people come in to say, this is the way I feel, and this is the way I've been treated, and we feel this is an Islamophobic act. And all of this, we come together so that we can address this together, so that we feel that we belong, that everybody is, we are pharmacists, we are professionals together. One person should not be intimidating another person irrespective of religion or ethnic minority. So this is where I'm coming from. So that way we can work, we can develop professionally, we can be free to come and open up, speak our mind, and that way everybody can live in peace.
Brilliant. Thank you, Sharifa. It is all about making sure we're creating that culture where people can be themselves and feel like they belong, to be who they want to be, regardless of what that looks like. And, so I think that's a really good point. My second question is, then, can we start with what is Islamophobia? So I appreciate that some people might not be aware of what that term is and may not have come across it or really understand what it may mean. Sharifa, I'll come to you. What does Islamophobia mean?
Islamophobia is any act, any act that any person make another Muslim feel that person is afraid to exhibit the religious acts of being a Muslim. So maybe at work, maybe the person is just praying at the side, and you make the person feel intimidated. Or another person, a Muslim, is being afraid or to exhibit that they are Muslim because a particular that employee or an employer has exhibit. So in short, Islamophobia is in meaning is acts, traits, the way you behave that makes a Muslim feel uncomfortable, feel insecure in a workplace, at school, in an environment, or even within colleagues.
Thank you. And Khalid, did you want to add anything to that?
Yeah, very basically, it's racism with a religious twist, isn't it? And you'll find many, you'll see it on social media kind of platforms or conversations taking place where people will deny any kind of bigotry. They'll say, well, it's not racism because, Islam's not a race. And when they're saying those things, you know exactly where they're coming from. It's cloaked, isn't it? It's disguised, and it's almost like a loophole. When I was growing up, racism was rife, and you'd get called the P word, the abbreviation of Pakistani. It was very common, very frequent. Then it became less acceptable. Laws were passed, etc. But then all of a sudden, it was replaced. So when kind of Islamophobia reared its head, and it's not been around for centuries, but when it reared its head in its current form, I think those people who were quite happy to be racist in the 90s kind of jumped on that bandwagon, and this is the vehicle that they're using now. So it is a religious level of hatred and discrimination, but it's got that racism underpinning it as well. If we look at the stats as well, just in the year ending March 2021, 45% of all recorded religious hate crimes were against Muslims. It's a huge amount, and I don't know the exact stats, but a lot of them will be against the most vulnerable, in particular females. If we look at the GPHC data as well, in terms of our makeup, out of about 60,000 registrants that we have, about half of them have declared a religion. 14% of those are Muslims, have identified as Muslims, which is the same as Christianity, or people have identified as Christians. So, you know, we're a big part of that register, a big part of the workforce, a big part of that population, and we have this thing that we have to deal with, and that's why it's such. I'm not saying that we should have support because we're in large numbers. Quite the opposite. If somebody's, you know, every minority should be supported, but there's so many of us, or so many people on that register who are experiencing this or vulnerable to this. It shows you the scale of the problem. When you put all those numbers together, it shows you that scale of the problem and the number of people that need support in the workplace.
Yeah, no, that's a really good point, and particularly with the intersectional piece of being a woman as well. You know, there's additional barriers, and I know I've seen it in the workplace. If you're wearing a headscarf, you know, wearing more traditional dress, how people may treat you and react to you. So it's definitely something that we need to be talking about. And then I know you've touched on it a little bit, Khalid, but why is it important for us to discuss in pharmacy? You know, how people in the members of the profession shared experiences with yourself, or have you experienced it?
I've certainly had experiences shared with me. Like I said, I'm quite lucky in that people don't tend. I think people, you know, bigotry is bullying, isn't it? Ultimately, I think people tend to go for the easy, vulnerable option sometimes. I think when you look a bit like Hagrid from Harry Potter, sorry, people tend not to pick on you as much, but if they see you as quite an easy target, they'll go for you, and that's why you see lots of our sisters are disproportionately targeted, and you'll find a lot of the younger workforce will be disproportionately targeted as well, rather than the senior leaders, because it's harder to do that, isn't it? So I've come across many cases of trainees, so pharmacy trainees, what we call pre-regs before, who've come to me, you know, outside of our organisation, but they've come to me because they know I'm involved in training, etc., who've had overt Islamophobic experiences. There was one trainee I remember, an overseas student. I remember he was saying that he was at his place of work, he was ready to go for and he said to the staff, "I'm going to go for my Friday prayers." And the locum just turned around and said, "Oh, he's a terrorist, is he?" Blatantly. This was only 2 years ago, or within the last 2 years, so it's not like, you know, a different time. And no one stood up for him. No one backed him up. There was a few awkward looks. When it was reported to his supervisor, this is a really troubling thing. The supervisor took no action whatsoever. Didn't think it was an issue, just shrugged the shoulders. So that was one case. So that's within a team. My wife wears a headscarf. And I remember she was targeted by a member of the public. So something wasn't right with the medication. It hadn't come back on time, etc., something like that. And all of a sudden, it was the daughter of the patient just exploded. And the first thing that came out was, it was that foreigner with the thing on her head. Now, there's lots of ways she could have been described.
Yeah.
That's the one that she went with. So that's what's bubbling underneath a lot of the time. And sometimes it takes a trigger. You know, so one of my colleagues, when I first started working in community pharmacy, he said to me that there are certain areas where if you weren't the healthcare professional in that area serving them, they wouldn't tolerate you. They only tolerate you because you're serving them. But when things go wrong, that ugliness will come out. And that's what in community pharmacy, when I was working, you know, at the coalface, that's what you would see. Someone could be perfectly nice, but something went wrong, that ugliness comes out, and what they're thinking comes out. And you know, we took a zero tolerance policy, which is if you abuse the staff, then you don't come back. You find somewhere else to go. In these incidents are quite common. There's one more that I want to share, which is a really interesting one, because it was somebody posted on a groups, pharmacy group, saying, "I've been working at a place, very uncomfortable working there, and I want to report the place." It was part of one of the largest chains in the country, and this pharmacist been working there as a locum on the day. He was British white male, but he was a revert, so he was a Muslim. The staff didn't know. So he was working there, and the staff were talking about the pharmacist the day before in really, really derogatory, bigoted terms. and he felt so uncomfortable that he wanted to get some support and report it. So when I asked him to get in touch with me, I put him in touch with the superintendent, and they took action from there on. But those staff wouldn't have spoken like that in front of that pharmacist.
Yeah.
They waited till that pharmacist went, and then they spilled the beans because they felt safe because they had a lookalike pharmacist with them. Now what's interesting is sometimes you'll hear locums will say, or pharmacists say, that they'll go to a place and they just feel like they don't fit in there. They feel like something's not quite right. They can't put their finger on it. I know exactly what they mean. Sometimes we don't have the evidence. For what we have the evidence for, we know it's a problem. The reality is, though, it's a much bigger problem than we realise.
Yeah, no, they're really good, sad examples, but good ways of demonstrating how it manifests. Because it comes back to, there's a book that I've read, it's called The Good Immigrant. I don't know if either of you have read it, but it's about we're okay while we're kind of towing the line and we're not causing any problems. But as soon as something goes wrong, like you said, that tolerance piece, and then, people don't, like that, what's bubbling, it definitely can manifest. Sharifa, in your experience or what people have shared to you, how has it manifested in your workplaces? Oh, Sharifa, you're on mute.
Yeah, sorry. Yeah, I mean, we can see what if the NHS Muslim Women Association published some articles lately about Islamophobic acts to sisters, so Muslim sisters within the NHS in different forms. Even patients that wear hijabs that comes in for maternity care, the way they're being treated because of their hijab, and even the staff taking care of them. And as pharmacists, some of our pharmacists that come from overseas that wear hijabs, they've been refused. Customer will say blatantly, I don't want the girl in the scarf to attend to me. And personally, I've experienced that during the COVID vaccination. Some people refuse me to vaccinate them because I wear. They just said it's just an open statement. But I mean, luckily, because sometimes you have management that can understand, and they just say, okay, if she's not giving you the vaccination, you are not having your vaccination here today. So we've been, the theme of this year's Islamophobia, tackling denial, is a very good one, because we have to really acknowledge the fact that Islamophobic acts exist and people do it all over in pharmacy practice, either in community, hospital, industry, wherever it is. Some of my colleagues have come back to me, as a BIM executive, when I was, as a vice president, with so many queries, some because they were praying in the staff room, and it was like, oh, what are you doing here? Are you going to plant a bomb in here? Someone said that actually to his sister, and she called me to report. And people with hijabs, they've had people said to them, this is too long. There's going to be infection all over the place. So all of those little acts, little statements, diminish people's confidentiality, and to be able to, some people, these are people that can say it. Some cannot even say it because they have the fear of maybe attack, the fear of harassment, or the fear of stigmatization. So all of those little acts are all over the place that people feel confidence to come to you because they feel, okay, maybe you are nearer to people that are going to make a change. So, it's these things that we have to listen. I think what we need to be doing now is listening and accepting and investigating those acts and bringing those people that exhibit those acts to Muslims into conversations, because we need to encourage people to understand the fact that though we have cultural differences, but we're still professional colleagues, and we're treating the same patient, we have the same acts that we want to exhibit within the community as well.
Yeah, no, and what's shocking when I'm hearing your experiences is how blatant it is. Like, I know there's racism across the board and people experience it in pharmacy, but it's just that blatantness of people saying stuff, and people are unapologetic about it. No one should be thinking it in the first place, but the fact that they have the confidence to be able to say it and feel like they can and know that there's no consequence to that action, that's what's really worrying. that's not okay. And is how do we change that culture of people like not saying that or adding consequences to those actions?
I think I would say it's about letting people realize it's not acceptable, and bringing people to book. Employers, colleagues, friends, all of the statements. Let people understand this is not accepted, and this is not good. Imagine, mental health issues, people just go down with statements that you can accept, and you don't have anyone to talk to. So once people can speak out, it's good. At least you can accept that. But there's some people, you will have said something to them and they will not be able to even speak out. They don't have anywhere to ask. The fear of even asking, but if I say something, maybe they're going to report me, or I'm going to lose my job, or I won't be able to go out anyway, or I will be stigmatized. Nobody will call me for anything anymore. So all of those little things, until we just raise this awareness, it is not acceptable. It is not right to treat another person this way.
Yeah. Khalid,
well, similarly, I think to stop people being so blasé about it, we need to take it seriously and treat it like racism. There are certain words now which 50 years ago were acceptable. Now we wouldn't think of saying them, rightly so, because we know it's wrong. We know what the consequences are. Similarly, this is where targeting somebody because of what they believe in or their faith is should fall in the same category. It's one thing having an intellectual conversation or something. It's another thing targeting somebody, discriminating against them because you think they're beneath you, because you think they're backward, because you don't believe in what their thoughts are. And that, we discussed before, and I was debating whether we bring up the whole World Cup controversy or not. There are some very, very legitimate conversations and criticisms we have about the World Cup at the moment. But the way the conversation has been had, it's almost like we're superior, we're intellectually superior and you're backwards, and you need to be like us. If that's the thought, if that's the way people view the other side of the world, that's the way they view other people who look like those people on the other side of the world, which are us. So, we have documented cases where in medicine, for example, in the healthcare setting, where you will have somebody who is in a consultant position, for example, who isn't a person of faith, maybe an atheist, etc. They will view anybody who has a faith as being backwards, and they will treat them with that contempt, that lack of respect. And that's what that's a level of arrogance, number one. But it brings about discrimination, and forget inclusivity, which is what we're working towards. It does the very opposite. And what we need to be working towards is inclusivity, which is I don't think we'll have time for that today. But that's a conversation maybe next year we need to have about how we make our places more inclusive. But at the moment, we need to take away that real ugliness, negativity that's there at the moment. There's very interesting. I don't know if you saw it, but at the Chemists and Druggists Awards, or if we can mention a rival publication or not. But there was a diversity and inclusivity award that was given to Head of Education England for the Oriel recruitment process, because we did some number crunching on that, and what we found was that what Oriel did was it created a centralized recruitment kind of platform which removed the traditional recruiter out of the system, and it placed people according to their performances on assessments. What we found was that the representation of different ethnic groups in the most sought after places, like hospitals, has increased post Oriel compared to the years before Oriel. And we've done the stats on this, and there's going to be a paper published very soon on this as well. It's really interesting information, and people who work in hospitals say, we get very different cohorts now. Well, it makes you wonder why that is. Now we can't make too many inferences about why it was, but it makes you wonder what was the process before, when there were more white British males in hospital pre-registration posts than there are today, where there are more and more trainees from a BAME background. And actually, the biggest winners, funnily enough, are Muslim females. So Muslim females from a Pakistani Bangladeshi background. Bangladesh is quite a small sample size, so that's not taken out. But the biggest swing in terms of representation at those hospital placements has come in those people who are visibly, whether it's by their name or appearance, Muslim. So it's it's a conversation we're going to have, more digging we're going to have to do, but there's certainly something that's changed there. That's
really interesting, isn't it? Just what that shows. And also truly representative. If we are a profession that's 45% and probably more actually since registration, like Asian minority ethnic and 62% women. So that representation makes complete sense. So we've kind of touched on some of the experiences that individuals have had and people have shared with you. And I know it can be difficult to manage that directly, but what advice would you give to anyone who is experiencing this at the moment and how they should handle it? So Sharifa, I'll come back to you first with this question.
I would say just for example, just as Khalid has said, and the PDA BEM committee had a toolkit that we did to enable you to report racism within workplace, and we can have that. Something like that within pharmacy for Islamophobic acts as well. That's number one. Then number two, people should speak out. Find someone that you're confident to talk to, someone you can trust, someone you can say, this is what is happening. Because what will happen is this: if you're able to say your part, it might be someone else there that wasn't able to speak up. So that will go across border if someone is speaking. And number two, if you can't say it, write it out to someone, maybe to RPS or GPAC. You might not mention any name. Make it anonymous. Just write it and say, so is happening, just to let you know, so that we can act. People can't see it, and we'll be able to support our colleagues, our pharmacists that have been affected. So all those three examples are things that we can put in place, and that will be able to support us as much as possible, some of our colleagues, and even our employers as well, even our pharmacists.
Brilliant. Thank you, Sharifa. Khalid?
I can only echo what Sharifa said there, documenting the incidents and not suffering in silence. So when we do our induction day for our trainee pharmacists on day one, the very final slide is do not suffer in silence. There are lots of people who want to help. They may not be in your organization, but I think like BEAM, I think one thing we're trying to do is create that network so that people can seek help. There's other great organizations out there as well who are trying to help. But certainly don't suffer in silence, I think, for two reasons. Number one, it's not going to get any better for you if you do that. It's going to get worse. And honestly, we don't tackle the problem, and we have to tackle the problem. I think we have a wider obligation to the profession and for those coming after us that when we see something, we call it out and we try and leave it better than how we found it. So one of the things that motivates me to take part in something like this is that we can't just leave things unchanged because we'll have the same conversation in 20 years' time. So let's make that start, certainly. The other thing is pharmacy is a vast kind of sector. There's lots of different career opportunities. If you're not happy where you're working, call it out, report it. Don't worry about losing that job. You'll find something somewhere else. Pharmacists are in huge demand, and actually that's probably not the sort of culture and environment that you want to be in. So don't fear what's around the corner. Something will open up for you, inshallah.
Yeah, no, thank you for both of that for that advice, and that's a really good point, and one that actually can be applied to any situation. If you're not happy in the place that you're working, there's so many more options. Don't force yourself to stay where you're not valued and treated as an individual. And then because a lot of this comes from the top, doesn't it? That culture, that setting from within the organizations, and even from like the RPS, GPHC, how do we make sure we're setting the right culture to make sure that Islamophobia doesn't keep happening? What are practical solutions that organizations can take within their policies, in their bullying policy, or in their uniform policy, for example? Some I know I've seen are very out of date. What could people be doing? So Khalid, I'll come back to you on this one again first.
I think the first thing I'd like to see is a zero tolerance approach to any such abuse, whether it's from the patient population or whether it's from within the team itself. We need to treat these incidents as seriously as possible and really, really send that message home that it's not acceptable. So that's the first thing. And I think the other thing is that, if you want to know what sort of policies to put in place, speak to the Muslims who work within your organization. What's important to them? There's not a huge amounts of adjustments that need to be made or tweaks that need to be made to make a workplace inclusive. Ultimately, Muslims tend to be quite spiritual people, and one of the few things that we need in a workplace is time to pray on time, and maybe sisters need to wear certain clothing, maybe need to wear a headscarf, some don't, etc. It's all very individual. But if you allow that for the prayer thing, for example, probably an extra 5, 10, 15 minutes in a day. But if you went out of your way to kind of accommodate, and we're not saying build a room or set aside a whole prayer, but just a little office or something where they can pray, and you being the first one to kind of make that move, saying, I understand that you have this need, and I'd like to kind of propose a solution for you, will make a huge difference. I had a few months ago, I had and I'll say the kind of characteristic because it's important. A white British female texts me. She's a good friend of mine, pharmacist. She texts me saying that, look, I've got a couple of Muslims working for me and I want to make some adjustments for them, but I don't want to offend them. This is what I'm thinking. And she told me what she was thinking of doing, which was very simple things. And I said, you know what? Never mind offending them. You'll make their day because they'll feel so appreciated and so special and valued because of what you're proposing. It's about making an easy place for them to pray. So I said, go for it. Definitely. Don't worry. Don't think twice about it. And she did. And she came back the next day and she said, oh, they were amazed. In fact, there were tears and hugs. They felt so valued. There was no money involved. There's no building extensions or anything like that. It was very simple. But it's that thought, isn't it? It's that knowledge that this person actually values me for who I am and understands what makes me tick and knows what's important to me. What you're going to get with that is a much better workforce. You're going to get, on one side, I'm kind of reading some of the messages coming on the other side. Quite, you can see people are really not happy in their workplaces. You're not going to get a very productive employee when they're feeling like that. But on the flip side, you make a very small change, you get a completely different personality, and somebody who's going to literally run through walls for you, is going to be highly motivated and be very, very loyal. So it's about having that conversation with your employees. Ask them, what's important to you? What can I do to make this place more inclusive for you? They're not going to be asking for much. There's not much we can ask for and not much we need. But the very simple things which make a huge difference.
Yeah, no, brilliant. Thank you, Khalid. Sharifa?
Yeah, I mean, I'm just going to echo what Elsie I just said, that when people are speaking out, you should make sure they do it in a safe place, in a safe way. And I mean, lastly, I would just need to thank you for organizing this and tell all pharmacy colleagues, if we are experiencing any of these, please speak out. It's important. And make sure when you do this, make it safely, in a safe way, that you'll not be targeted, or you'll not be, people are different. They can understand things in different way. I mean, you can lose your job. I mean, people have lost their job by speaking out. So please, as much as possible, when you feel your colleague is being affected or you have been affected, speak to someone that you feel you have confidence in and someone that you trust. Thank you very much.
Yeah, brilliant. Thank you, Sharifa and Khalid. And I think that the chat has been incredible throughout this whole thing, and people are sadly reflecting on their experiences and agreeing with what you've both said, and which is very telling and what more we need to be doing. Yes, the importance about doing it safely, raising awareness, making sure you're safe. You're the most important person in this situation, and that there's psychological safety around that. But there's all things organizations can be doing, and like you said, Khaled, just small changes. I think it's just being seen, isn't it? It's just the fact that, oh, actually, thank you for asking about this, because it might be, I'm okay without it or with it, whatever it looks like, but it's just asking, and you can't really go wrong without that. So but I just want to say a massive thank you to both of you for taking your time this evening to speaking to us. There were a couple of questions in the chat box, but I think, because one is about the GPHC's view on racism in the workplace, but and please do chip in, both of you. But I think obviously the GPHC, we just had a roundtable on racism in pharmacy. The GPHC just held that, and we're looking at things we could be doing with the GPHC, but I know that they have a no tolerance policy as well. But Khalid, from your experience at working with the GPHC, is there anything you'd like to add?
When it comes down to evidence, if there's evidence that a colleague, a registrant has been, racist, etc., they're going to be in for a hard time with the GPHC. There's no doubt about it. They're not going to go easy on it. I think one thing that would be really helpful for the GPHC to do is start collecting data on incidences like this. I don't think they have that. I think they should make it priority to start collecting how many incidents of whether it's Islamophobia or something else that they want to investigate, and start building up that picture with that data. Once they have that, they can see how much of a problem it is, and maybe then they can start. I'm not sure what they can do exactly, but at least we can on the theme of denial, we can highlight what a problem it is, and maybe if a few people are made an example of, that might help as well. Yeah,
no, thanks. Sharifat, did you want to add anything?
I'll just echo what Khalid has just said. This has called our near miss error, near misses. All of those things has to be documented and coded once we see them and we dealt with. When this is because just the same way we have as adverse side effect as our medication, the same way this can affect people's lives as well. So I hope this is going to support us and support every member of a pharmacy profession. Thank you.
Yeah, and actually, I suppose in some ways that's what the GPHC Fitness to Practice service is there for. People who are displaying this kind of behaviour are not being professionals and not meeting the professional standards that they should be abiding by. So, use it as that as well as a reporting system, because otherwise it won't get picked up. I don't think there are any other questions, just more comments of support for the conversation. So I'll end the conversation here, but it's been a great conversation. I think it's really, I know for me personally, it's been the first time I've had this discussion, and hopefully this is just the beginning, and we could be doing more in this space, and not just for Islamophobia Month. This is something that obviously we need to be talking about all year round and building into other things that we're doing. So just a final thank you to both of you this evening, and thank you for everybody for listening.
Thank you to you as well.
Very much. Thank you.